I hope everybody's having a great Monday. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going over knee pain with cycling. So we talked a lot about running. Tonight we're going to talk a little bit about cycling. So whether it's a cycling outside, whether it's cycling in a studio, whether it's a Peloton at home, we're going to talk about the differences in knee pain, what happens while you have knee pain, and how you're going to fix that knee pain. So first of all, let's talk about the bike setup. So it's really important that you have a correct bike setup. And I don't have my bike here with me, otherwise I would show you. But what you want to do is you want to sit on the bike and you want to make sure there's a slight bend in your knee. So if you have a Peloton, you have a very easily adjustable handle below that can make sure you have it on the right setting. So there should be, when your leg is fully extended, there should be a slight bend. You don't want it all the way extended and you don't want to be riding like this. All right, so you want to make sure that at the lowest point in your cycle that there's a slight bend in your knee. And then that way when you come up, you're only going to come up to here. If you're riding with your knees in your chest, that's not a good thing. Now, if you are setting up your bike to ride outside, I really recommend getting it professionally fit, especially if you go for long rides. It's really important that you have a specific fit because the handlebar adjustments and the seat adjustments, and there's so many things that you can adjust. So if you haven't had a professional bike fitting, I really recommend you doing that in order to get the body position correct when you're riding outside. Not so much when you're inside on a Peloton or on a regular, just a studio cycling bike. But if you're putting a bike on a trainer, like an actual road bike on a trainer, or you're cycling outside on a road bike or even a mountain bike, I really recommend you getting it professionally fitted. You still want that slight bend in the knee as you come down, but again, you have to make sure that your handlebars are adjusted correctly. One of the things that you really want to pay attention to also is, as you cycle, you want to make sure that your booty is back on the seat and your back is flat. One of the main things that happens, and it completely affects your hamstrings and your back and everything and your knees, is a lot of times when we're exerting ourselves, we start doing this. And we wind up just in this hunch position and we're sitting back. Well, what happens is as we sit back, that affects the hamstrings, that affects the knee. All right, so be careful when you're doing those types of exertions. You want to make sure that your back stays flat. Roll your shoulders up, back, drop them down, and then lean forward into your bike. You should not be crouched over. You should not be gripping the handlebars for dear life. Your hands should be light on the handlebars. You should be just bent over at the hips. You shouldn't be hunched over. It's super important, just like when we're talking about running posture and just when we talk about running and how you should run, it's super important that you have proper posture on the bike. That's going to affect knee pain. So if you're experiencing hip pain or knee pain and you're riding the bike, watch your posture. That's one of the things that you're going to have to correct. You cannot cycle with improper posture and beat the knee, hip, or ankle pain or back pain or whatever you have. So it's a losing battle if you're just going to say, treat me and I'm not going to change anything. That's not going to happen. Make sure that you're really looking at the bike. Also, if you're staring at the bike, this is the front of the bike, your hands are resting nice on the handlebars. You want to actually have your elbows turned in. So the front, that crease in your elbow is actually facing forward. All right, you're going to feel a little bit more in your core activate, down in your stomach. You're going to feel a little bit more of your shoulders. Okay, that's what you want. So when you're riding a studio cycle, a Peloton, you want to turn your elbows in so that these creases are facing front. Again, you don't want to be gripping any part of that bar. Fingers want to be light, but you want to bring them in. You're going to feel your shoulders activate a little bit. And you also want to look for the dropping of the shoulders. As we cycle, we tend to do this, and we're all hunched up like this, and we're really trying to do a HIIT workout or whatever it is that we're trying to do. Super important that your shoulders up, back, drop them down, rest your hands on the bar, lean forward, hinge forward at the hips, don't bend forward. Hinge at the hips, rest your arms there, make sure your elbows, the crease of your elbows are facing forward and that your booty is back in as far as you can on the saddle. Now, obviously, as you sweat, you're going to start to slide up a little bit, but make sure that that sits back because that is going to affect those hamstrings. Your hamstrings come up and attach right there on your glute. So you want to make sure that all of this is in proper position. So let's talk about knee pain with cycling. Very common to get knee pain with cycling. The most common diagnosis is Itb and Tendonitis. So what happens is you're going to feel pain on the outside of the knee. You're going to feel pain coming down in here. You're going to feel pain, or you're just going to feel pain right here. And it's going to be really hard to cycle around. It's almost going to feel sometimes like there's a click. Not all the time, but sometimes like there's a clicking feeling because that IT band is so tight on the outside of that leg that you're going to wind up having that pain. And you're going to wind up with that knee pain. And it's going to usually hurt going up and down steps. It's not just going to stay with the bike. So one of the things that you have to really watch, and this is really with any type of cycling injury. So if you're clipped in, sometimes those shoes have a little bit of give, or even if they don't, you wind up cycling with your knees almost like this. So pay attention as you're riding, and this is whether you're on a road bike or a studio bike, that your knees are going directly over your toes. A lot of times you cave in like this, even though you might be clipped in, even though you're like, oh, that's impossible. That's what happens is you wind up riding more like this. And this is a little bit more of an exaggeration. If your knees are rubbing together, of course you would notice it. But you want to really watch the position of your knees as you cycle, because it's important that they stay over your feet. All right, what'll happen is it'll just be a slight little like this, all right? And you won't even really notice, and then you'll look down and all of a sudden you're seeing your knee kind of come in a little bit, and then you'll get some knee pain. So really important, no matter what your pain is, hip, knee, back, doesn't matter, you want to make sure that that knee is tracking directly over those shoes, directly over that foot. It's going to irritate that IT band otherwise. So the IT band is going to start here on the outside of the knee and come all the way up and go all the way into the hip. Most popular cycling injury or tendonitis is that IT band tendonitis. And what are you going to do with it? So you're going to foam roll. You can go to our other channels, our other YouTube channel, our YouTube channel, Total Performance Physical Therapy. We have tons of foam rolling videos. If you have that knee pain, you want to get rid of that IT band. Stretching it isn't going to do anything. You want to go and you really want to work on that IT band. You really want to foam roll all of the leg, really, and the low back, but you really want to foam roll that outside, that IT band, because that's what is going to cause that pain generally on the outside of the knee. Now, sometimes you can get some knee pain on the inside of the knee, and then that can be caused from the inside groin area being a little bit tight. So again, that's usually because you're doing this. Your knee is coming in when you're cycling, and it's usually not right away. It's when you get tired. So you want to roll out the inside of your leg. Do maybe some stretches for the inside, but don't do stretches until you roll that out. It's going to be painful at first, so you might want to start with a flat roller instead of a spiky roller. And again, our YouTube channel, our Facebook channel, Total Performance Physical Therapy, all you have to do is look up those. We have several foam rolling videos. The hard thing about knee pain is because no muscle only attaches at the knee, it's either coming from the ankle or it's coming down from the hips. So because of that, knee pain isn't always knee pain. Knee pain can be coming from the back. So if you're cycling like this and you're hunched over and those hamstrings are not working, this is how you kind of shut your hamstrings off and allow them to go weak, you can have some knee pain. It may even be in the front, maybe on the side, but you can have some knee pain that's caused from hamstring weakness. A lot of times the quad up here is a lot stronger than the hamstring, which is in the back of the leg. And if you're someone who constantly is riding like this, you are actually weakening those hamstrings even further while strengthening the quadricep. When there's that muscle imbalance, this one is pulling harder than this one, you're going to get knee pain. Sometimes it can be in the front, sometimes it can be in the side. It depends on how the other muscles are working together. But that is a common issue, is weak hamstrings. And I don't want to classify it as any sort of, oh, you're going to have knee pain in the front or knee pain in the side. Because depending on where other muscle imbalances are, so we call that a muscle imbalance. One muscle is weaker, one muscle is stronger. We call that a muscle imbalance. So depending on where those muscle imbalances are will depend on where you feel the pain. You can feel the pain in the back of the knee, you can feel the pain on the side of the knee, but usually it's those weak hamstrings, and it's usually caused from this slumping. So not to disregard the fact that the IT band may be tight, you may have tight quads, you may have tight adductors, but another cause of that knee pain in cycling is from that hamstring weakness, and it is from this type of posture. You want to kind of set maybe an alarm, some reminder to check that posture every couple minutes on the bike, so you are making sure your shoulders are relaxed, you're making sure your elbows are in, your back is nice and straight, you're hinging at the hips. Again, if you're able to do that, you're going to be able to use that hamstring. You also can develop patellar tendonitis, which is pain right at the bottom there. And that is, again, from this muscle, these muscles up front, your quadriceps, pulling and working harder than these muscles in the back, your hamstrings, then your adductors, then your IT band. So making sure that you're able to strengthen all of those muscles, making sure that all the muscles around that knee are equally strong, but also equally rolled out is super important. And that's going to help take away some of that knee pain. A lot of people switch to cycling at times because they find that it's gentler on the joint. So while it's not running and you're not pounding, you can really develop some significant knee pain because of improper form and how you're strengthening. You also want to make sure you're doing different types of workouts. So if you're on the Peloton or if you're on a studio cycle, you want to make sure that you're still doing a strengthening workout, that you're maybe doing a HIIT workout. You're not just riding, and you're doing some stretching, some yoga, some different types of workouts. Doing one exercise, I don't care what it is, running, cycling, is never a good thing. You're going to wind up with that tendonitis. So varying what type of workouts you do throughout the week is also going to help. But one of the things that you do want to make sure that you pay attention to is don't ignore that knee pain with cycling. There's a lot of positions that you can actually move your knee into and your hip into to make you ignore it. So a lot of times people maybe will start riding with their knees a little bit out, change how they're kind of sitting in their seat. Those can help decrease that knee pain. All you're doing is making the problem worse. While it may feel better, you're not fixing anything, you're just making it worse. So really pay attention to that seated posture. Really pay attention to, oh, my knee pain went away. Find out where it went. It didn't get better. Find out where it went. It went somewhere and it's getting worse and not better. If you or someone you know is experiencing knee pain or knee pain with cycling and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to help. Thanks and have a good night.